Lumbar spine passive physiologicals for extension. 3 different positions we can do this in, and a lot of that will depend upon the comfort of the patient and what they find is the best position for them, where they feel most comfortable. A lot of that you'll get from your subjective history, so please bear that in mind. Your subjective history is so important to tell you what might work from a treatment perspective. For the supine, really nice technique in terms of being able to do grades 1 and 2 mainly. You might be able to push towards a 3 or 4, kind of just going into resistance. But in general, this is more of a kind of an earlier grade, a grade 1 or 2. Quite nice as well for if you've got a reasonably debilitating type back problem that's got a lot of muscular spasm. I'm not talking about something that has some form of disease, but something that is more spasm related due to perhaps an acute incident that they may have had. So from a supine lying position, we're going to be similar to our flexion, coming round onto the pelvis and up under towards PSIS, so that we can feel the pelvis. We're doing the mobilisation from the pelvis, so this is a mobilisation from bottom up in terms of the lumbar spine. From there, what we're going to do is have a nice firm grip again clamping this arm in, and my arm closest to me is going into my pelvis, so that I've got a nice solid firm grip and I'm not just relying on my arm strength. And then from there, what we're going to do is we're going to pull the pelvis upwards and downwards, so we go up and roll down. So have a watch. Up, down. And then we can just oscillate a nice small mode for a grade 1, and larger for a grade 2. Notice my body comes with me as I go into the mobilisation. For prone lying, so if you want to turn over onto your front form, please. Prone for extension, as with anything when the patient is lying down, we can adjust their positioning of the pelvis and lower back with pillows and towels in line and under the pelvis. So that's entirely up to you based on your patient. In this scenario, so I'm not going to do that for now, but what we're looking at performing now is an extension. With this, you could look at doing this as a grade 2, but it's probably a little bit more aggressive than that, so I'd say this is much more moving into the grade 3, grade 4 type handling. We're going to be using this leg, the leg closest to you, to aid in the extension mobilisation. So to a certain extent you are offsetting to one side, you're providing the extension on one side of the lumbar spine. The whole lot will move, but it is more orientated. So clearly, if they have an extension loss that's on the right, you would do it on the right side using the right leg. If it were bilateral and I wanted to use this position, I would do it twice on both sides, so that I was working on single side at a time. So what we're going to do is take the leg, bend it up to around 90 degrees, resting the shin against your forearm, raise the leg up so that your hand comes just underneath and onto the knee, and then this hand is going to come onto the pelvis on the right hand side. So if you've got iliac crest here, we are placing towards iliac crest and sacrum being just here. Then as we apply the mobilisation, you're going to raise the leg up and push the pelvis upwards. So have a watch. So raise up, and you can watch for the lumbar spine extension. And part of the reason your hand is here is if you just lift, they can start to twist over. We don't want that. We're clamping that down, and then we encourage it to go upwards into extension. So have a watch. So it's up and extend. So grade 3. Or grade 4. Now in this position, the patient is already in some level of extension. If you want to see more motion, or perhaps if you want to back off a little bit in terms of the grade, then probably pillow and or towel underneath the pelvis and neutralise the spine. You'll see that you're less into extension, but you can probably see from the camera angle this is a relatively extended spine already. So that's quite aggressive towards the end of range. Okay, the other way of doing extension is to have the patient seated. So if you jump up just for a minute please, jump off the bed, we're going to twist the bed round. Okay, so take a seat facing that way. Hold a sec. Okay, take a seat. Okay, move towards the back of the bends into the back of your knees. That's perfect. Ideally when you're doing this, you want to do it on one end of the bed. For the camera, I'm not going to do that because it wouldn't be an ideal setup in terms of the positioning. So I'm going to do it in the middle. But the reason you would do that is it gives you more flexibility to be able to move around towards the side of the patient. So try that. The easiest way is if you put them at the foot end of the bed, facing away from the base, from the bottom of the bed, because then you can get to either side of them. If you put them on one end and twist them to one side, you can only go on one side. But anyway, in this position it is possible to still do the technique. So what we're going to look to do is they're going to look to come back into extension, leaning backwards. We're going to ask them just to take their arms across the chest, a bit like we will do for thoracic spine, and then they're going to lean right back. What we're not asking them to do is to raise the arms up. They just keep their arms flat against their body and they take their whole body back in this direction. What we have to do is we have to, one, act as a support for the head and neck, and two, we have to stop any motion coming from the thoracic spine, and that's really quite difficult because most people will tend to try and do that, a lot of that motion in the lower thoracic region. But to ensure that it is lumbar spine, we need to kind of lock that out. So our arm is going to come across their body so that we're in this position here. If you prefer, you can come underneath the arms, but actually for this it works quite nicely to go over the top as well. And then as they come backwards, you're going to have to lock with this arm here. Where you place this hand will be where you're focusing the mobilisation, the extension mobilisation. So if I want upper lumbar to lower thoracic, my hand needs to be nice and high. If I want lower lumbar, my hand needs to come down a lot lower. The lower you go, the more they'll try to lean backwards. So for the sake of this, I'm going to show an upper. Okay, so we're going to come up to kind of around about L1 region. Okay, are you ready? So you're going to place your arm across, your head kind of goes into their neck region so that depending upon their range and how far back they come, they have some level of support. Okay, so from this position here, what I'm going to do is I'm going to pull back and then from here push forwards. So let's have a watch. There we go. Okay, so that's our kind of testing of the range. I'm doing a grade 1 and clearly I'm not going to come very far. Grade 2, a bit further, but out of resistance. Got to keep this, my right arm locked in. Grade 3, coming further back. And grade 4, towards the end of range. Now if you get this wrong, you don't apply enough pressure on this arm, then this happens. See how the motions come from their hip, as opposed to if I lock this in, motion comes from higher up, and they don't come as far backwards. So that's the way you do lumbar spine extensions, 3 different positions.